Yesterday we said that we would invite Oxfam, and they're actually here in studio. We want to have a conversation around some of the statistics they've been sharing with the country, including today. For instance, on the Daily Nation, at the very front page, wanasema ya kwamba about 1.13 million children of primary school going age are out of school, and nearly half of secondary school going students are not accessing secondary education at the appropriate age. And then they go on to give more numbers there. For instance, 117 billion. A report from the Auditor General shows that between 2020 and 2024, public schools faced a funding gap in capitation to the tune of 17 billion. All right, so allow me to introduce Rogers Kidia. He's Accountable Governance Lead at Oxfam Kenya, and Anthony Kamande, Inequality Policy and Research Advisor at Oxfam International. Gentlemen, welcome to Radio Generation. Let me start with you, Kidia. Good morning.
Asante. Good morning to
yes.
you. Good morning, Kenyans.
Good
Happy
morning.
to be here.
Right.
Yes.
Anto, karibu tena sana to Radio Generation.
So thank you so much. Good morning, everyone.
I remember I was asking what Oxfam is all about, and you've given me an overview.
Yes.
But for the sake of the listener who's probably hearing about it for the first time, what is Oxfam?
Okay. Asante sana. Asante wa Kenya. Oxfam is an international confederation of around 21 organizations in 77 countries. And the confederation is working to end poverty and injustice. Particularly if we come back here at home in Kenya, we work together and collaborate with government institutions, civil society organizations. We collaborate with the private sector to tackle the problem of inequality.
Right.
And we do this just through two things. One, we do humanitarian responses on issues to do with drought, flooding, and conflict, especially in the ASAL areas. We've been there for over 50 years.
Yes.
And on the other side, we do development work that is system strengthening. And we do things like fiscal policy.
Right.
We do things to do with natural resource governance and many other things.
Yes.
Yeah,
All right.
Oxfam.
All right. Thank you so much for that. Anthony, there's one thing about the conversation we were having yesterday as far as the report by Oxfam is concerned. How old is the data that you collected? Perhaps you can give us the periods that you were talking about in the report, the 8-page report, right? What is the period of research?
Sure, so thanks for that. So we have out of data point in that report. Do have used up-to-date data. So, for example, if you're talking about the richest 125 Kenyans having more wealth than 43 million of us.
Yeah.
So that data is for up to 2023. So the most recent data that you can get.
Yes.
And of course, we have used a combination of sources, especially from the Kenya National Bureau of Statistics, from the World Bank, as well as from a company that specializes on gathering the data on the wealthiest. Because again, it's very difficult to get data on the top income there. So our National Bureau of Statistics, they don't do that.
Yes.
Because it's very expensive. So we have to rely on another company to help us be able to gather that data. Then, of course, we do the analysis.
Right.
So it's up-to-date data. Of course, for some of them, we have gone back to just checking what has been happening over the past one decade. So since 2014, since 2015. Then where we are at the moment. So it's varies.
There's also the question of the Kenya National Bureau of Standards that you've mentioned them, KNBS.
Yeah.
Do you, statistics, sorry. Do you compare the data with them, or are you completely independent of what they publish as far as similar data is concerned?
No, if you read our report, most of data there is actually from the Kenya National Bureau of Statistics, especially the economic surveys, as well as the household survey. So the problem is we don't collect the data frequently, especially when it comes to household survey data. It's very expensive to do it. The agency needs a lot of funding, but for the economic survey data, they normally do it. Each year. So we do rely on the national, because the official agency that give us the data on environment issues, on poverty, and all these some other things. But we also have to complement that with data from other credible sources. The expression most of inequality, it comes from the World Bank as well as from another agencies called the World Inequality Lab. So it's the global agency that actually has a massive database for all the countries on inequality.
Yeah, that report was quite damning, Kidia, in regards to the findings. For example, what he has just mentioned right now. Some of it, of course, information that we already had.
Yes.
Matters to do with inflation. That one we already knew. President has been mentioning it, and it's one of the actually key points he says has improved. And I agree, a lot has improved. But when we talk about the standards of living of Kawaida Kenyans,
Yes.
what can you say according to your report?
Please allow me to start with definitions, because Mwalimu is here, and when he teaches, he says start with definitions. So let me start quickly with definitions.
Go ahead.
So there are two terms that you will see, not the other two terms, but there are two terms that you will see predominantly discussed in the report: poverty and inequality.
Right.
So what is poverty? Just quickly, poverty in its actual sense is basically lack of resources. You'd ask the question, do people have resources to survive in terms of food, paying school fees, shelter, and all that? And visibly, you would see poverty by hunger. You see how people live. You see visibly, you see these things. And how we measure poverty, we use the poverty line, which is a level under which anybody, in terms of consumption and also income, live by day. The standard that we have today is 130 shillings per day. So that is poverty. But when it comes to inequality, now we shift discussion a little bit.
Right.
Because inequality is now asking deeper questions and asking, why do we have many people who lack resources and very few people who have a lot of resources? So it's more systemic. When you look at poverty is more of a symptom, and inequality is systemic. And how do you visualize? If you go around, how do you visibly see inequality? We say inequality is usually visualized through contrast. So, for instance, where you have a Karen, you have what? A Kibera. Where you have a Mudaiga, you have what? A Madare. Where you have Loresho, you have a Kangemi. And this problem is, or this visual imagery and contrast are replicated across the continent. We've managed to be, let me say, lucky to do this work across the continent, in almost every city in the continent. From Bambane in Eswatini to Djibouti City in Djibouti to Antananarivo in Madagascar, then you move all the way to Bamako in Mali, and you will be surprised when you go to our major cities. The term Africa is rising is true. You see this high-rise buildings. You see these beautiful expressways coming up everywhere in the continent, in the cities. But just walk just a few meters away from the city, and you'll be shocked. You'll see the face of poverty. What I've said, the issues of degradation, the issues of poverty, even in the faces of people. The younger they are, you see a lot of brightness, but the older people, you see dejection. And these things are replicated. So what we are seeing, and what we are saying through this report, is that the type of development that we are seeing in Africa is not sustainable. Because the problem with inequality is that it breaches the contract, the social contract, where people now feel, no, this is not right. When you have a cake, for instance, a big cake, so poverty would be like, we have a very small cake and we are so many people, we have to fight for that. But inequality, one person would come, take 90% of that cake, and then the hundreds of you will have to fight for the other 10%. So that is the face, and that is what the report is saying. People have been looking for how to define what we had last year, the struggle and the feeling that people are saying, why are we developing averagely 5% in the last 10 or so years? But mbona si feel Where is that feeling? The answer to that is inequality, that actually the development that we are seeing is more towards the haves, and the poor are getting poorer, unfortunately, in the country.
We read a few parts of that report yesterday.
Yes.
And a section of our viewers were disagreeing with some of the statistics. For example, there was, when we mentioned about the cost of, was it food, that had risen by about 50%.
Yes.
Some were saying that hapana, chakula limeteremka, unga is this much.
It's not even listeners. I was the first one to say 50%.
Yes.
Yeah.
So
ask where exactly and which commodities are we referring to? Yes.
yeah. So perhaps Anthony, if you care to chime in.
Yeah, sure. Actually, that 50% is from 2020, just for the context. So since 2020, the cost of food has gone up by 50%. So the inflation. So over the last year alone, it's just again the KNBS data. So they published it, I think, yesterday. So the food inflation is up by 7.7%.
Yes.
In just 1 year. Here we are talking about 5 years. Then, of course, we had like 2022, 2023, part of 2024.
When you say food inflation, what do you mean?
It's, I mean, there's a way that our agency does measure the things that they include. I can't go into the specific to say that.
Just give an overview. Yeah. So that when you say food inflation,
basic food items.
Yes.
The basic food items. Whether you're talking, the flour, maize or whatever, white flour. Whether you're talking about farm produce, the tomatoes.
How many commodities do they look at?
I don't have a specific number on how many commodities that they do look at.
Yes.
But that's the data.
But these are the basic foods that people tend to buy
exactly.
for sustenance on a daily basis.
Yeah,
yes.
yeah. Okay. The other thing with inflation is that our inflation at the moment is about 4.5%.
Yes, it's about 4.5%.
But the food inflation is, 7.7%.
That is why we need to be able to distinguish and ask for that specification as to what it is we mean by food inflation. Because the way the layman judges the cost of food is what it is they pay for it.
Yes.
If last month or the previous month, the previous year, when I went to the supermarket, the cheapest bag of maize flour cost 250 shillings, and now the cheapest costs 140. When you say there's food inflation, I'll be asking, what do you mean? It costs less now than it cost 2 years ago. So what is this inflation?
No, it's not about just one item. You have to get mad for items. Of course, they do the weighting and so on and so forth. In 2020, I used to buy a packet of milk at about 45 shillings. Now it's about 65 shillings. It's just one item. So you can say maybe the maize flour has gone up, but most of these other items have has gone down. Most of these other items have gone up. You have to pay more to get those items. Of course, when you go to a supermarket or in the market out there, you don't buy each and every item. So maybe you pick one or two. Sometimes you might not feel that the prices have gone up because it's incremental. So if you had 100 shillings, last year the prices have gone up by 7.7 shillings. That might not feel like a lot of money, especially if you also have a lot of money. But for the poor person, that means a lot. Imagine a woman earning 200 shillings per day. Then they have to pay an extra 8 shillings to be able to access food. And we are being impacted differently. Again, it's the poor people because they spend most of their income on food compared to the wealthiest. So when the prices of food go up, it's that common person who is being impacted the most. The impact is not being felt quite massively at the top there. That's why we should care about some of these things. We should care about the food prices and do something about it, because without doing it, we're going to hurt the common person.
When you talk about cost, you're now talking data, you're talking statistics. Does your report give statistics as to, for instance, wherever it is you get your information from, the key foods that are looked at with reference to arriving at this food inflation, which are they in this country, over which period? 1. 2, does your report give statistics as to when you talk about the number of poor people increasing, what it is that you mean by the number of poor people increasing. Is it the affordability? Is it that there are more and more people losing jobs, or there are less and less people who actually have money? What is it? Because if less and less people have money, then it therefore means that the demand for the food that is there will also go down, because there'll be fewer people who are able to afford it. So if the factors of production come into play, and you're looking at the very issue you've discussed, inflation, where theoretically we are told when there's a lot of money chasing few goods, the price goes up. But here's a situation where there isn't money. So how on earth then would the price of goods go up? Has production also reduced? How do you nitty-gritty go into the details so that when someone reads the report, they understand exactly what you mean by the conclusion that you've arrived at?
Yeah, that's a good question. So when we are saying that extreme poverty, I mean extreme, so people living under 130 Kenya shillings per day. So the number of people living in extreme poverty has gone up by that 7% since 2015, which is massive. As we speak now, almost half of Kenyans, they live under extreme poverty line.
Where do you get these figures from?
So these figures are from our agency, again, the Kenya National Bureau of Statistics.
And Kenya National Bureau of Statistics are the ones who have said that close to 50% of the citizens are now living at the level where you could refer to them as being extremely poor.
Yes, this is from the Kenyan BS as well as from the World Bank. So, our agency do the household survey data. So the thing is, you can read our reports to get some of this nitty-gritty on how we are going as far as what is concerned. But 46% of Kenyans, they live at extreme poverty line.
These reports that you speak of,
we need to stress
figures. 4 million Kenyans are in the condition that you speak of. The number has been increasing steadily over time. There are approximately 6 million right now in the condition that you speak of, where they do not know whether they are going to eat tomorrow. They actually have no clue. All right? That I understand. What is our population? Let's put it at 50 million. So you're talking about 10%. When you talk about 50, do you know what you're saying? You are saying that half of the people in this country do not know what they're going to eat the following day. And I'm saying that is not true.
You can say that's not true, but that's not what our data is saying. Our data is saying almost half of Kenyans, they live at extreme poverty line.
This is a 46% now.
Yeah, 46%. So that's almost half. Extreme poverty line, which is abject poverty.
Who determines what the extreme poverty line is?
It's a World Bank extreme poverty line of...
Okay, so for someone to be extremely poor, what do you need to have? What are you surviving on a daily basis?
It's 130 Kenya shillings.
Now 130 Kenya shillings in the city or in the rural areas?
So we are talking about the national.
And I'm trying to tell you so that a large number of our population is in the rural areas. 130 shillings in a rural area is very different when it comes to what you can use it for and what you can buy with it than 130 shillings in a city like Nairobi. It's very different.
Yeah, and I know that you can imagine that almost half of Kenyans live below that. It's very difficult to comprehend.
No, it isn't difficult.
But we have millions of Kenyans.
It isn't difficult.
Yeah.
The point I'm trying to make is this. You have your data. There needs to be, first of all, what was the sample size? This data means you've concluded and said we've added A, B, C, D, and we've arrived at this. The sample size. Okay, when we were looking at the data and interviewing people, because you interview people and you look at certain indicators, did you go through all the 47 counties? That is actually impossible. You have to sample. That's why it's called a sample size. You look at, say, I go to Mandera, the condition in Mandera is the same as one in Wajir or Moyale, and that is it, and so forth and so forth. When you arrive at something as dire as 46% of this particular country are living below or are on the fringe of starvation, that's what you're saying. There is need for you to give details of how you arrive at it. It's important because 46% of the country essentially not knowing what they're going to do the next day. That is no longer a food crisis. It's a security crisis.
Yeah, sure. Just to answer your question, if you read our report and read it carefully, that data it's not Oxfam data, first of all. It's the data from the Kenya National Bureau of Statistics, as well as from the World Bank. So it's not our data, because we don't like go out there and do surveys. That's not our business. So we have to rely on data that have been done by credible institutions whose mandate is to do exactly that.
So let me get this straight. What we are saying is that the National Bureau of Statistics has said that 46% of Kenyans are living below the poverty line, and this is of course data that they have collected in conjunction with the World Bank.
Exactly.
And it is the World Bank that determines that this person is poor, because poverty is defined as someone who's living below 130 shillings a day. Now, is it possible that, and this is just now I'm asking because I don't know, is it possible that I could be living in Kitui below 130 shillings, but in my shamba I have maize, I have mangoes, I have whatever, sukuma wiki, manago, so I really do not have to spend 130, because I can literally just go chuna sukuma kwa shamba yangu, niko na nyanya pia katakata kula. Is it possible that there are people who are living like that? They don't spend money, but they're within this 46%.
That's exactly. That's a good question. It goes down to how household surveys are done.
Yeah.
For developing countries like Kenya, we normally use expenditure. How much are you consuming? So if you have your own shamba, you go to your shamba, you get your food. So there's a way that KNBS, the World Bank, do convert that one into monetary term. They can say that this is amount of money that, you could get if you are earning, because we know that here in Kenya it's very difficult to get income data compared to what happens in each country. So they have to rely on fiscal data, tax data. But for poor countries like ours, it's the expenditure. So you have to, or consumption, whatever. So you have to look at what people are consuming and then convert that one into monetary term. That's what we have here in Kenya.
All right.
Yes. If you can chime in here. Yes, it's true. When you look at KNBS data, the way they define, because the international poverty line is cross-cutting, and we use the purchasing power parity. And for KNBS, they define different types of poverty line. We have the urban poverty line, and we have the rural poverty line. Of course, the rural poverty line is a bit lower compared to the urban poverty line, but when we are talking about in our report, when we say this is like a combined, a consolidated data, like a national level poverty line. So the national level poverty line is combination of the two. When you look at the poverty line, we'll give you the numbers. I think it's captured. The rural one is way below, close to 20 to 30% lower compared to the urban poverty line. Yes, but in terms of literal definition, because we are looking also in terms of comparison, ladies and gentlemen, and also Mwalimu. In terms of comparison, because if I was to do this report, and Oxfam has been doing this report for many years, hundreds of years in different countries globally. So what we are trying to do is to have a comparison and a national level kind of consolidated data line is something that we use in terms of now discussing, for example, your person in Kitui, whatever. Of course, the feeling is different, but in terms of statistically talking about people living under that particular line, it's true that it's 46%. On the nitty-gritties, the percentage might be lower, but in terms of just a relational that we can relate, for example, I can tell you that it is 46% in Kenya. We have a bigger problem, for example, in other countries like DRC, Botswana, or comparative analysis that we do in the Latin Americas, which now they would have above maybe 50-60%, which is a big problem.
Really?
Yes. So
we are doing better than them.
Yes. We have countries that are far off, even in terms of the inequality index. We are ranked 16th in terms of extreme poverty. When you look at our reports using the just statistics line. That is how we are ranked. But countries, in terms of the inequality index, when you look at countries like South Africa, you look at the Botswanas, the Namibias, they have higher. I was to briefly talk about the Gini coefficients.
Please do.
And yes, so when it comes now to discussion, I know the discussion around poverty is very dicey, and I think the takeaway for Kenyans here should be that this particular line that we are talking about is a national level poverty line, and it is something that can help us to think policy-wise, in terms of the actual and differences, the rural and urban is something that can be discussed, and that's why research is usually done, and this is the home for bold truths, and this particular research is supposed to be discussed that way for us to have such kind of conversations, and we'd like to have those conversations.
As we continue, nilikuja kujua there are levels of poverty.
Yes,
there are levels of poverty because when I went to some slum areas, I discovered that there are people who buy gas on a daily. I didn't know this. I thought that the most thing that we can buy daily ya kupika chakula ni mafuta ya taa. Until I discovered there are places where you actually unapata mtu akona mtungi ya gas, na hiyo gas iko na meter, where you can purchase gas for as little as even 10 bob.
Yes.
You make your kaega raka go to work, and you have to top up again if you need. So I came to understand there are levels of poverty where you can even, kuna places where unaweza ile unga unadhaningi unanunua hapa ati half a kg, kuna mtu ananuanga unga ya kikombe. So I discovered that there, when you go to these slums, even mafuta ya kupika, forget mafuta ya taa, cooking oil,
kupima. And then
there are levels.
You see in Kenya, most of us, because unga is a political issue. So unga and these consumables that people keep on taking every day. So whenever people talk about food inflation, I've been listening to this discussion. When people talk about food inflation in the country, the first thing that comes to your mind is unga ya ugali. So the governments are aware of this. So they will try as much as possible to ensure that unga it's always around 150, 100 to 200 shillings. And you remember last year when it gone to above 210, the way people are now going, the unga revolution and all that. But now when you extend that, because on the basis of just poverty, when you extend it to other areas like you mentioned, like milk, when you look at other produces, rice,
you know, people don't
just look at the numbers right now. Just look at the numbers. Kenyans can, they're online, they can tell us what it is. And for us, because we like to look at data and not the issues of, for example, politics, Kenya Kwanza, wherever. These issues are actually colonial legacy programs. And in my context, when I was giving context, I said this is a problem, it's an African problem, it's a Latin problem. That now the way we are developing, we are building more millionaires and crowding out in terms of poverty and people who are impoverished. So, back to your question.
Yes, please.
So, the issue to do with the Gini coefficient and inequality. So a Gini coefficient is a measure that is used globally, especially in terms of income. The how different income is. So 0, it's between 0 and 1. So 0 is perfect equality. Everybody in terms of income. Kama mimi, mwalimu, everybody here, we earn the same in terms of income. That is perfect equality. And then 1 is perfect inequality. So perfect inequality is where one person, so wewe sasa mzito,
ndio sonko hapa,
wewe ni sonko, you own everything. You own everything in the country. And the way you said the quality and we said a symptom of inequality is what? Poverty. That's why we started with this debate with poverty. So with that poverty that you are talking about, the differences, unaenda mtu anasema do not kitaka kuingia kwangu unakata tu na karatasi, like there's no need of knocking, you just kata, and that is now extreme poverty and just a symptom of how big the inequality is. So when we look at Kenya, our Gini coefficient is based on KNBS data. Again, we go back to KNBS every single time. And because they are our partners, and most in the peer review of this report, we had government. Yes, we had government, Kipra, and all those people who are part of us, who helped us in terms of peer reviewing these data sets. And we are saying that, for example, our Gini coefficient is 0.46. When you compare the Gini coefficients, 0 to 3 is considered to be low. In countries, for example, that the Norwegians, the Scandinavian countries, the Germanys of this world, they have very low coefficient. It means generally people are earning almost similar amounts of money. Then between 0.3 and 4, 0.4 is considered to be moderate inequality. And that is where you find, for example, most European countries and the like. And then from 0.4 to around above 0.4 is considered to be high, and then beyond 0.6 is considered to be extreme inequality. So for us, we had 0.46. That means we have high inequality in the country. And that is the reason why all this discussion has started.
I have a question.
Yes.
This is unrelated, but still, germane to the conversation.
Yes.
Switzerland.
Yes.
I was reading somewhere that there are no poor people in Switzerland. Is that true?
We do a lot of meetings in Davos. We actually, maybe just a side note as we go, now that you've raised the issue of Switzerland, we do Davos reports for the last, since 2014. We've been producing the global inequality, status of inequality globally. And because we usually have the Davos meeting where billionaires come and whatever, so that's why we usually produce our reports. Back to you, sir.
Yeah, sure. That's true that in each January we normally publish our global inequality report. But back to your question, yes, Switzerland is actually one of the richest countries
in the world.
There are few poor people there, because again, when you are that rich, almost everyone is a millionaire, then also the cost of living there is
very high.
It's also very high. That's why actually you see most of the UN bodies are coming to Kenya, because in Geneva it's
expensive.
Very expensive.
Mkate ni pesa ngapi huko?
I don't know, but it's very expensive. Very expensive. So back to the inequality question, why we are in this situation that we are in it, what we need to do. So we must remember that this country is growing. So each year we are getting quite impressive numbers that the economic growth is going on well. But why are majority of Kenyans not feeling it? Why are we becoming poorer? So the reason why this is the case is because of how the system how the system has been designed. So you have workers, especially the low-paid workers, as well as the poor people, paying more in taxes than the richest guys in this country.
Are we talking about percentages or the actual amounts that they actually pay?
I'm talking about percentages. But I'm going to I'll go back to that. So if, for example, you earn 1 billion Kenya shillings in dividend, you are going to pay at most 15% in terms of taxes.
That is 150 million.
That's 150 million.
So,
but if you are a teacher and you earn your 50K, you are going to pay up to 30% or probably more of your income in form of taxes. So you see that the less money you have, the more you are going to
pay in taxes.
And the impact this has is that you make those people who don't have a lot of money poorer, or sort of increasing the wealth of the richest guys there. For example, if we have like about 11,000 dollar millionaires who have like more than 50 million USD, so we are talking about 16 billion at least Kenya shillings on average. So if these people, you want to tax them for up to just 5%. So 1%, 2%, up to 5%, we could get more than 450 billion Kenya shillings.
Wait, are you saying that we have, I mean, did you say we have here in Kenya again?
The people who have like,
dollar millionaires, yes.
Yeah, dollar millionaires.
Yes, how many?
So we have like $11,000 millionaires.
$11,000 millionaires here in Kenya.
Yeah.
Natives of Kenya or plus internationals?
Native. We have wealthy people in this country who again are not paying their
the
fair.
problem is that he's thinking of people he knows. He has imagined a rich, and it has occurred to him they're not dollar millionaires.
I've just realized they're broke.
And they want 25.
So,
do you know any?
So, but if we were to just tax these people up to 5% annually, we are getting more than 450 billion Kenya shillings, which is enough money to pay for the universal healthcare or even build like 3 Riloni Mau Summit highways. So we actually don't need this tolling or maybe getting all these loans if the wealthiest people in this country are paying their fair share of taxes, as we ordinary people are doing. And we also must remember that, we keep on hearing this discussion that if you are not employed, you are not paying taxes. That's not true. The poorest people, again, going back to them, the low-income earners, they spend most of their income on daily necessities, whether they're talking about food or somewhere to live. So they are going to spend almost the entire income. You get your 500, your 200, you are going to spend it that day. And if taxes on the goods that you are paying are higher, you are going to pay more in taxes compared to this wealthy guy here who has like hundreds of millions, because how much can they eat each day? It's true to have the same stomach, but they're going to pay less in taxes. And this has an impact on ordinary people because we are not going to get healthcare. In our report, we are seeing how people are being excluded by this new social health insurance, because if you do not have like money to pay for it, you are going to be excluded. And again, we are saying almost half of Kenyans, they live under 130 Kenya shillings per day. And we are telling them to pay 6,000 per year. They're not going to afford that. You have to make a decision. Okay, am I going to pay for this chef, or am I going to give my kids food?
By the way, so we are saying that this 46%, if these numbers are anything to go by, these people can't even afford SHA.
They can't. We have.
But remember also, when you talk about SHA, what the government has said is that those who are in that category of people you say who live below the poverty line, they will get it for free. Now the problem is, does the government share this view that you have of those who fall below the poverty line? Because the government has a list of people who are older than I am, which means really old, and people who are disabled, people who are unable to earn an income. These are people who, according to what we've heard, ought to receive this service for free.
Actually, yes, I remember the president did say, he said somehow they're going to find how to recoup that money somehow from the economy. He even said he has donated, I think, part of his salary or something. Was it? Anyway, there's something he said that he will donate, not his salary, I'm not sure. Wacha nisidanganyane. But he did say that, and he even urged the MPs and CSAs to find a way of just getting money for this 46%.
Can I respond before you come in? On that issue with she, but we also do this in our report. So Germany, they tried this contributory health insurance scheme, and it took them more than 100 years to achieve universal healthcare. So they started it in 1883, and they achieved it just the other day. And Germany is one of the richest countries in the world, so almost everyone there is in the formal sector, which means that, nazama inakatiwa kwa whatever. Compare that with Kenya. So we have like 4 million Kenyans who are contributing to SHIF. And again, you have to remember who is contributing. It's mostly the low-paid workers in the formal sector, because the way the levy is, it's a flat rate of 2.75%. So it doesn't matter the amount of income that you earn, you are going to pay the same rate, which of course hit the low-income earners in the formal sector the most. But as if not that is enough, we have like other Kenyans who cannot afford to pay it. these are stories. We are hearing it from our friends, from our family. We are seeing it that people are being told, if you are not contributing to SHA, we are not going to admit you in this hospital. And of course, people don't have money to do that. All that means is that you are going to have like unnecessary deaths that could have been prevented. You are going to have orphans that should not be there if our healthcare system was working. You are going to have sort of permanent illness that should not be there if our health have like enough resources. What we need, political will as well as progressive policies.
Yeah. Yes, please chime in.
Yes, let me chime in on just two things on the shift.
Can I ask you to borrow this microphone for a minute? Yes, just grab it. You can swing it over. Right.
Am I being targeted politically?
Yes, you are.
Someone is trying to grab you. Yeah.
So two things. One on shift, and I was very happy. I was very happy when the president said what he said, because part of our recommendation is if we can at some point consider increasing the percentage in terms of investment to healthcare to 20%, so that we have a mix. We have a mix of the income contribution, but also from the general tax budget that now can be invested directly to hospitals, because these contributory systems, I work.
Yeah.
And like you've heard from the Germanys of this world who've trialed this, many other countries, the Japanese have trialed this system of contributory or insurance-based premiums.
Right.
When we have 80% of informal workers, then it is, firstly, it is unjust, and also it is unsustainable.
Yeah.
So we tunapea heko president, but we want to see if we can do more investment in terms of just from the general budget. On issues of education, and this will really interest Mwalimu here. Something very interesting in the report. We mentioned something very very interesting. During our launch last week, we had the Director General for Education, and we had a very big exchange with Honorable Ndindi Nyoro for the untrained. Please go and check that video. It was trending everywhere. So there was a discussion about capitation. So capitation during Kibaki era, 2003, for primary schools was 1,420 shillings. That is what now every student was receiving, or a pupil in primary school. 1,420 shillings.
Yes.
What do we receive today?
I think this is 16,000.
Primary schools. Primary schools.
It's supposed to be 20.
Not high schools.
Oh, that's high school.
That big figure is for high schools.
That big figure is for high school.
I don't know the one.
Let me shock you. It's 1,420 shillings. Nothing has changed since 2003.
Okay.
For an economist like me, I will, of course, want to do real terms. So the real terms, if you adjust for inflation and whatever, that 1,420 shillings then is 250 shillings today. So what...
Repeat that.
Yes, the 1,420 shillings that schools received in 2003, what they were able to purchase that time.
Yes.
That amount of whatever amount today is 250.
It's the equivalent of 250.
It's equivalent to 250.
Okay.
If we were to match the 1,420, we need 8,470 per student in terms of capitation today.
Okay.
Imagine the gap. So we are asking, we did a survey, and I'm very happy when we have these online discussions that there are teachers, high school, primary school head teachers and all that. If we did rounds in our work, and every schools, people are complaining. Averagely in Kajiado County, from just our engagements, because we work in ourselves, they recorded almost every school 20 to 30% in the last 2 or so years drop off in terms of school enrollment, because of course people have to do the trade-offs. Do I pay? Because the schools will demand and say, tukona workers hapa, we need to pay them. These 250 in real terms cannot sustain for capitation all this time. So there's a problem. in terms of education funding.
You know what I find strange though, when we talk about a country like Germany,
You can take your microphone now.
they took 100 years to achieve universal health care. Why don't we talk of Thailand? Why don't we talk of China? Why don't we talk of Rwanda?
Yeah, actually, you have done a good thing mentioning Thailand. Actually, Thailand has managed to achieve UHC by spending, with a low budget. We have some countries who spend like huge amount of money, especially the US, on healthcare, but the healthcare system are not that great. But Thailand, I think we should borrow as a country from Thailand as well, that they have managed to achieve the UHC through public investment in healthcare. And that's what we need here in this country. So we need a tax-funded healthcare system. So at the moment, we are spending just 6% of our budget on health. Imagine 6%.
Rwanda next door. Why don't we look at their system?
I think for me, the best one should be Thailand. Because they have managed to achieve the UHC through public investment in healthcare. And as I was saying, we are not doing that. It's a country that we are waiting, or we are telling Kenyans, we are paying taxes, but you also need to pay another tax to access this healthcare, which is not even fair, because we are spending just 60% of our budget on healthcare, which is actually like half, most less than half of the recommended spending amount of 15%. We can do more as a country to close this gap, and by doing so we are going to save lots of lives, especially for low-income earners, for poor people, because they are the ones who are being impacted again the most when we fail to spend on healthcare. The wealthiest people in this country, they don't go to the public health facilities. It's for the ordinary people who go there. That's why we need to ensure that we are spending and also spending equitably. So we need to see more money going into like primary healthcare facilities in the village out there, because they are accessible to a lot of people.
I'm actually curious, CT, how is the Kigali one done?
Yes.
Look, it's to put it simply in layman's terms, it's government involvement. The government has just ensured that they've allocated adequate resources to ensure that it happens. It's not even complicated. The point that I'm trying to make is this. If you look at SHA is the authority. The primary healthcare program, which essentially looks at the preventative aspect of healthcare, and it is whittled down to the most basic form of healthcare, a dispensary, okay? That is where the focus should be, and in this country, it is free. And the only way it can be free is if government puts money into it. Now, that hasn't happened to the degree that is necessary for it to actually work, because preventative and promotive healthcare is understood and known to be the way in which you solve healthcare problems. You don't wait until it gets to the curative stage. But it gets political when you have this discussion, because there are those who are determined that we must buy drugs. There are people who are determined people must go to hospital and be hospitalized, because it's a business. Preventative healthcare actually precludes all these things here. And research that has been done on this very, very same thing, the integrated community care management that was done early on in this century in Homa Bay County, looked at diarrhea, malaria, and pneumonia, diseases that when they progress will actually kill you. And they looked at managing this thing syndromically at the level of, say, a village. It reduced health care presence within the hospital system, where you now need to go and actually get treated, by up to 70%. Yes. So it's not something.
Principally, it's just government.
You can have your microphone back.
Yes.
By the way.
Yes. It's not. This isn't magic.
Now my detractors are over.
No,
yes.
This isn't magic.
Yes.
County governments complain about not having enough money for healthcare. They can't, because they're focusing on the curative aspect of healthcare.
Yeah.
They will never have enough money. There's no country, forget country in the world that will be able to afford any healthcare system if that's the focus. The focus is you prevent it. You make sure that disease does not advance. Then you're able to manage it and you're able to afford it.
There's a comment here from Star Kenya. He's saying that if you interrogate...
Start again, once upon a time. Yes.
If you interrogate the base assumptions of these research things as dictated by the World Bank, etc., the true picture begins to emerge. So basically Star Kenya is saying that because it is backed by the World Bank, there's another agenda as opposed to just finding out the facts.
Why agenda? There's a way in which they look at things, and there's a way in which we look at things. I'll give you an example. For the longest time, the Juakali sector as we know it was not used whenever people are talking about the poverty index in the country. The World Bank didn't consider it. Now they understand it. They didn't understand it then. Okay? Now, when you're talking about industry or light scale industry or SMEs as we call them, you're talking about the Juakali sector. That's where the bulk of our people do their businesses. We call it SMEs now. Okay? But that's where it is now.
Still informal.
It is very informal, but that is where people are. That's where they earn. They are living. So unless the government has tried to tax it, I think the government is trying to tax something they don't understand very well. So even that process of taxing it, you seem to be smiling. If you understand the system, then you will understand that the way in which you tax such a system is not quite in the way that they have been suggesting it. The way they suggest it, you're guaranteed you'll tax less because people will now avoid. They'll look for ways of not paying you. Anyway, I'm getting political.
Yeah, that's true. I mean, you mentioned about the labor market. It is also one of the greatest drivers of inequality, as we have shown in our report. That, I mean, this known electoral Kenyans, that we have like about 3.2 million Kenyans who are formally employed. Then the rest, about 85%, are in the informal, sector. Where the pay is low, you have to work for long hours. There's no like paid leave, and all these other sort of things that we are saying. I mean, this can be changed, especially if you have like a good or great public investment to create not just jobs, quite a jobs, because we keep on hearing each year that the economy has created 8,000 jobs. Do we ask ourselves, which jobs are we talking? Where? Because we are just creating jobs in the formal sector where people are being paid like 5K, 10K, which is not enough to sustain them. And of course, we have...
but does it qualify to be part of the statistics that these jobs have been created?
It qualifies to be part of statistics, but the quality of that job, it means that person will remain poor unless they get... good job, they get higher pay to be able to afford the basic necessities.
Go ahead.
Allow me to connect the two. I don't know if you wanted to.
No. What I was just going to add was a small little bit.
Yes.
When you're talking about the food poverty line, you are talking about consuming a certain number of calories that is considered to be what a human being needs to survive. Okay? Go ahead.
No. Can I answer that?
No. Go ahead, please.
Sure. Actually, if we go to that food calorie,
that is precisely...
It's even worse. It's even worse.
But it is important. You know why it is important to go to the calories? You are then looking at what people eat and what it is they can afford to eat. And you are then determining whether that can actually provide the nutrition that they actually require to be healthy. So that when you're talking about now the health index, you will have a basis on which to now have that discussion, because you've actually broken it down and understood why it is where it is.
We have a minute, so I'll allow you to go what you're saying about the nutrition, then you connect it, and then we close it.
Yeah, sure. I mean, I was saying that if we start looking at nutrition, it's the number of Kenyans who cannot even afford recommended nutritional whatever is even worse. And that's why we are just looking at are you eating? That's why we are.
Something in your mouth.
You have something in your mouth. Not because it's not good.
I had a lot of things to say, but we have the two things that are causing all this trouble. One is the debt the debt crisis. So right now, for every 100 shillings we collect on tax, according to KNBS, we pay 68 shillings. We pay 60 to debt repayment, just debt repayment. That means how much money do we have to spend on all these public services, the healthcare and whatever, and it brings the other animal.
That too, Bob.
Yes, it brings the other animal of quote unquote austerity. That's why we are privatizing everywhere, and we are not stopping. Currently, we've switched our debt. Our debt sources. We are now looking more. 57% of our debt stock, as we speak today, is domestic debt, and government is going to this very expensive long-term debt, and it's causing a lot of pressures in terms of. So we have so many recommendations here in the paper in terms of how government can go about it in issues to do with the informal and formal sector in the country. There is something called tax productivity, and this year KRA were jumping around, and we were very happy together with them that we had managed to get to our targets. But the percentage, 54% of all our tax revenues came from what? Indirect taxes, which is VAT. Okay. So productivity of VAT is at 34%. What I mean of productivity, it means how good or how we are able to collect. It's 34%. For corporate income tax, which is a big hole that we've not been able to do, is 21%.
Rogers.
Yes.
What I will do.
Yes.
Do you have time next week, both of you?
Yes, we can.
Come, let's get granular on this particular report.
2 hours.
Yeah.
Fantastic.
Let's come with 2 hours. We just talk and talk and talk. Otherwise, I don't want to be fired. Yeah.
Yeah.
This is where we take a break.